Hello, everyone. This is Dr. Jennifer Hobson. I am the director of the Renaissance CranioFacial Group of Physio Partners. I'm here to present a webinar on our posture and breathing program for children. I'm going to go ahead and share screen. Okay, so this is Physio Partners Renaissance CranioFacial Group. Just a little bit about me. I am a leader in the head and neck field for physical therapy. I've studied under Dr. Mariano Roccabato, who's a Chilean physical therapist that is very known in the area of craniofacial research and treatment. I'm a Buteyko breathing instructor, and I'm also incorporating Laney restorative breathing method. I am a myofunctional therapist and also an instructor for the Academy of Oral Myofunctional Therapy. But I drive to continue learning more about the head and neck field and how it connects to the whole body. And really, children are the beginning of this issue. And I really want to help as many children as possible. I've had issues with my children and have learned so much from my training of how to restore proper breathing mechanics to little ones. So I wanted to go through this presentation and show you a little bit about what we do. So what's wrong with this picture? You see this little cute little adorable baby, but the mouth is open. The mouth is open here, and that is not okay. Children should not be breathing with their mouth open. This will lead to yawning and sighing all the time and snoring, believe it or not. So mouth breathing at night can lead to even sleep apnea. If you see this person with the CPAP. So what I want to show you is mouth breathing can also promote asthma. So the more people mouth breathe, you end up causing an issue with CO2 levels. We exhale CO2, we breathe in oxygen, and when our CO2 levels are low, our airways constrict. And what we do is treat with medication and steroids and inhalers, but one also could do what the body needs to do is retrain the breathing pattern. So our approach is oral posture training. What does that mean? It's mouth posture training, tongue positioning, myofunctional therapy. We're going to go into that. So if you don't know what that means, it's really tongue training or mouth training for position of the tongue and swallowing properly. Breathing retraining. We retrain nasal breathing, and we restore proper spinal curves. So posture, little ones have, issues with posture due to the phone use and iPad use. We also talk a little bit about nutrition and exercise. So what is oral myofunctional therapy? It's known as this program, and not many people know about it, but it does exist in the medical world as a program to restore proper breathing and proper swallowing. It's a 6 to 12 month program that for the first 8 weeks, it's once a week. Once a week that you basically retrain the tongue, teeth, and lips and nose to properly function. So after 8 weeks, it starts to taper off. What it does is it repatterns and improves function of the oral and facial muscles to eliminate oral habits like sucking on your thumb or biting your nails or biting your cheek. So those are the things. We also work on swallowing and address like tongue thrust swallow and grimace swallow. So this is kind of what it looks like when you treat these little children with exercises for their tongue. And it's all around lip seal. So we want to make sure our goals are nasal breathing. So if your child has issues with chronic nasal congestion, they're probably developing small in their face. And we'll go into that in a little detail in a moment. Lip seal, lips together, breathing through our noses, proper tongue posture up on the palate, supporting the back of the throat, and correct swallowing pattern. So we start with a myofunctional therapy kit, and you'll see all these little gadgets that we use to help us train the children's mouths and nasal breathing. I want to go into oral posture training a little bit. So if you look at this image, this is a side image of basically like your face cut in half. This is your tongue, this is your hard palate, your soft palate, your spine, and your airways back here. So ideal position of the tongue is tongue up on the roof of the mouth, right up here. And if you can see here, some people have the tip up, but they don't have the back up. So what ends up causing an airway compromise is the tongue kind of falling back into this space, this airway space. Not only that, you see this gap will create a low hanging soft palate. Now this image, you'll see when the tongue fits up on the palate, supporting the roof of the mouth, the teeth line up, you grow that width of that palate nice and wide. And when the tongue is down, you'll notice that the width is no longer wide. So you end up with kind of a very narrow palate and a low tongue posture. So notice where the tongue will rest when it's down. It'll rest back. So this is where the tongue will rest when it's up, away from the airway. And this is another example of a nice wide arch when the tongue lives up, especially when children are growing. When they're growing, their bones are shifting and the tongue is very strong. It pushes against the bones that are moving and growing, and it spreads wider. When the tongue isn't up there, it becomes a narrow palate. And that narrow palate becomes more of a V-shaped palate and a high arch palate. This is a nice wide palate where your tongue can rest very naturally and fit perfectly up there on the roof of the mouth. So what happens when the tongue stays low and you have a nice, big, high, narrow palate? I shouldn't say nice, but a very high, narrow palate. See here, this is a CT scan, an X-ray of your face. This is showing that the tongue is low here. That tongue, there's a little gap of dark, that dark black is that their tongue is not occupying that space. See the nose that is right above it? Do you notice this bend? Well, that's the septum. If the floor, let me just stop share for a second. If the floor of the mouth, if the floor of the nose, I should say, if your nose, your palate or the roof of the mouth is the floor of the nose, if it's up and high, guess where it goes? It pushes that septum and it starts to bend the nose. And whenever you bend the nose, it will cause a problem breathing. Normally one side is more blocked than the other, but that is another example of it bending because of craniofacial development, because of a low tongue posture while they mouth breathe. Many children mouth breathe because they're congested. Maybe they're not being treated for allergies, or mom and dad don't realize that they're always congested. That's what happened to me. I didn't realize my kids were breathing through their mouth mostly, and they became very narrow. Now, one other thing I look at and our team looks at is tongue tie. So the tongue tie issue is so underlooked. People do not realize that a tongue tie can cause a low tongue posture and can cause all these craniofacial midface deficiency developments. So I'm going to go ahead and show you a couple of things of what we look at when we're looking for breathing disorders in children and adults. So this is the Mallampati score. The Mallampati score is a score that you basically are measuring how well you can see through the back of the throat. You see that airway? You want to see that airway. You want to see under that uvula. You want to see the space under there, but you'll notice that class 4 versus class 1. 1 is normal. You can see way under that little uvula. And class 2 is a little bit lower. Class 3 is a little bit lower. And class 4 is the tongue is occupying the space and the soft palate has dropped. So this is an example of a tongue just not fitting in the mouth. And this is what happens to children, and they become adults, that the tongues just don't fit. And guess what? They end up snoring and having sleep apnea issues. Another thing that we look at is scalloping. Does the tongue fit in the mouth, or does the tongue have these little wedges where the teeth are, pressing on the sides of the tongue, making it imprint like that? That's a sign that there is not enough room for the tongue, that the palate is too narrow, and that the child or the adult is kind of pressed up against the teeth in a way that they're getting compressed there. Other indications of a breathing airway issue is a crossbite. If your child has teeth that kind of don't meet right, or they're crowded, you'll notice that that's a crossbite here. Their front teeth aren't covering their lower teeth like they should. It's this part of their face that is too far back. Here's another example of a crossbite. This is a midline. This is the midline, and normally you have these two midlines coincide. Well, this little one's mouth is over to this side, creating a crossbite situation where here there's overlapping, but on the opposite side there's not. This upper jaw should be wider than the lower jaw. Also, you'll notice a very long face developing, very narrow nose and a narrow mouth, and just a narrow face. So if you notice that in your child, they are developing this narrow, long face. They might have tonsils and adenoids that are swollen. So if your child has been, if they've had their tonsils taken out, or if that they're swollen, they're probably not breathing well. Not all pediatricians are aware of the effects of poor breathing habits on the craniofacial development. So this is something that starts to alter the way that the person breathes. So incompetent lips, the lips are not together. They're not touching here. So you'll notice here, the tongue is down because they're mouth breathing. Otherwise, the tongue would be pressing up on the palate, making this all wide and move forward as they grow. And this patient ends up having a low tongue posture in their jaw because it's down and not up and forward. It brings that mandible down and back. Constricted arches just means narrow jaws. This is a CBCT, a 3D X-ray of what this child is going to need to have the teeth come through. And notice there's not a lot of space to begin with. We're adding these big adult teeth into the situation, and they don't have the room. So you end up with a lot of kind of a crazy looking mouth with lots of teeth sticking out. This person needs tongue training and palatal expansion. Grinding. So if your child, if you've noticed that they're grinding at night and their teeth are, grinding, that is an airway sign. People grind and clench to help open up their airway space in their throat to help them breathe. And, it's not something that they just grow out of. They need help. They desperately need an airway approach to their treatment. This is another image. Like if you see your teeth, the teeth of your child really low, like very short because they've nodded off, that's a sign of an airway issue, a breathing issue. Also, overweight children have normally a breathing problem. This posture is what I call an airway posture. The position of an airway opening, if you can imagine, in CPR, we open airways by extending the neck, right? But if I extend my neck and then I just kind of drop here, this is a lot of kids are in that posture anyway, but that opens up the airway, but it also brings the tongue down. Whenever your head's forward like that, your tongue starts to lower, and it falls into that issue where you don't have the tongue posture up on the palate, pressing that mid face to grow wider and forward. So really the tongue, teeth, and lips are all we should need to develop properly. But when we don't have the proper breathing mechanics and proper swallowing mechanics, it changes the way our face grows. So let me go back to the presentation. So a high vaulted narrow palate, this is modern day versus pre-industrial revolution day. These slides are from Dr. Kevin Boyd, who's an expander, children expander in Chicago, that has done a lot of research at University of Pennsylvania, where these old skulls, pre-industrial skulls, were analyzed without cavities, wide jaws. It's modern day with, processed food and kids having allergies because of it, with low tongue postures and breathing improperly. But this didn't happen earlier on during the pre-industrial era. Eczema is also a breathing problem. Notice the mouth being open. This little child has eczema, and this won't fully clear up unless we work on the breathing. If their eyes, think about your child's eyes, if they have this pooling of, we call it venous pooling, those dark circles, they're not getting good oxygen to their brain. An anterior open bite, these are on other occlusal considerations that you see when your child's bite is open. Okay, you can also see here there's a lip tie. That lip tie also creates a little gap between the teeth and a short upper lip. The jaw sets back, retrognathia, so the jaw will set back into the airway. So here's the jawbone. You don't want this going backwards because it compromises that tube, your airway tube. We talked about the scalloping of the tongue. It just doesn't fit. This is the tongue tie issue. See how the tongue it's tied down? How is that tongue going to spread the palate wide if it can't lift? So we look for that. We work with many frenectomy doctors that release that with either lasers or other devices. We work with something called the Good Oral Posture Exercise, GOPex. It's a program that I recommend for any child, basically anywhere. We've been working with children through an app on the phone that connects us to our phones. The parent actually will take a video and send it to the reviewer. I'm one of the reviewers of this program, so we can set it up so that you can do a lot of the work from home. So it's a 30-day challenge where this app goes on your phone as a parent, and you connect to someone like me who's a trained reviewer. We go through exercises that are very simple, that are chewing and swallowing and reading out loud. Then compliance for this program is pretty good for it being a child, just because we're able to connect through this app. Sandra Kahn is the dentist that wrote the book Jaws. This is an excellent book if you want to read anything about why children have developed this issue with breathing and swallowing issues. Read this book, Jaws. She's also the one that kind of invented the app. Dr. Simon Wong was the one that actually created the program, but she invented the app. So we work on good oral posture exercises, click, click, close, and end, close. Let me just stop for a second. So click, click, close your mouth. So you want your tongue up on the palate, just like that. Or you say the letter N, close, N. So you remember, I don't want any gaps. I want you to put your tongue tip at the end and then close your mouth with no gaps. And let me keep going here. This is where I want the palate to be supported by the tongue, right where you say N, the N spot. We call that the incisal papilla. It's a spot that we need to make sure all our children and adult patients are aware of, and that they're resting their tongue there. Now, GOPex swallowing. We will work with your child to make sure that they're swallowing properly. This is also one of the 3 exercises that we get you to send us a film of. And the film is 30 seconds through your app that really help us see exactly how these patients are dealing with the exercise. We will critique the video that you send, and we'll give your child a score of 1 to 5 stars. So this is a counting exercise. Notice the posture. They learn this posture. They feel this posture. Children's in-person clinics we've had, obviously now, and due to COVID, we're kind of holding that at a pause, but we're going to hopefully plan to come back into in-person for that. And we are seeing one-on-one, but not in groups yet. But all of this is based on nasal breathing, proper volume, and rate for breathing retraining. Okay, so I want to share with you this mom. Let me see if I can open up a video for you to watch with me. And yes, I'm going to stop share here. Okay, here we go. So, oh, stop share. All right, here we go. Hi, everyone. I have Liz Scott here, who's a fellow physical therapist. Both Liz share the profession of physical therapy and understand the body and in many ways in alignment. I've been having the pleasure of working with her 2 children, DJ and Lillian, who I wanted to share with you, had issues with mouth breathing and sleep. And I was going to ask Liz if she can explain what she's been dealing with prior to us working together. What kind of issues were the kids having?
Yeah, so the biggest thing was that I noticed that they were both snoring. And we've been working together now for a couple of years. So, I mean, they were 6 and 5 around about-ish. And I knew that that was wrong. I knew that a 5 and a 6-year-old snoring was not appropriate. And it was actually after I took the breathing clinic, I think, that then I was like, oh, my kids need this too. And we need to stop this before it continues. So, yeah.
So Liz, it was our own head and neck job, patient of ours. We do in our clinic, we do breathing training called the Buteyko breathing method. And I do it for children and for adults. And it's all around proper nose breathing and volume, that you don't breathe too fast and too big. So part of it, we do a little taping of the lips, and we might use a little nasal dilators. How has been taping for your kids? Like, I know that can be really scary for some parents.
At first, they were a little, it was something new, but now they ask us for tape if we forget to put it on, so, and we switch between the myo tape and the paper tape. So, and then this one, just based on kind of skin sensitivity. So yeah, we'll just go back and forth between both.
So the idea with the tape is just to make sure that they nose breathe and that their mouth doesn't open. So how long would you say it took for the kids not to stop snoring?
As soon as we started taping, like pretty regular, as long as we were consistent, the snoring stopped almost right away. That was a near immediate change.
Wonderful, wonderful. Now, I know we've also done some myofunctional therapy with the kids, and we've done it in the clinic, and we've done some telehealth. Can you explain to the parents, I made you get this little kit that had all these little gadgets, and yep, we use them in the mouth to train their tongues. What was using these gadgets and like helping your kids? How was that experience for you?
So it made me realize things I wouldn't have picked up on otherwise. I had suspected that DJ's tongue was weak, and I didn't know exactly, but then it wasn't just his tongue, his lips were weak because he couldn't do the bottle hold either. And then through it, we also picked up on that they were like neurally tight, through their bodies. And so we needed to get stretching and doing different movements. They weren't coordinating correctly with certain things. And so I think it's things that as long as our kids are walking and talking and doing, okay in school, we're like, oh, they're fine. But when we start to pick up on all these other things, and the sooner, knowing the background, having the background I had, I knew the sooner I picked up on this, the longer I was going to, the sooner I was going to get rid of anything that could have, been long-term, asthma, allergies, breathing, all of those things. And that leads to just systemic too, like what their system is going to be like as they continue to grow older. So that it opened my eyes to things I don't think I would have picked up on.
Wonderful. And tell me a little bit about the GOPex, the good oral posture exercises. We use this app, right? This app that helps us connect on a video, and I grade them. Tell me a little bit how their posture, how aware of their posture are they now?
So they're so aware of their posture that they correct my husband and I. So if my husband and I are sitting somewhere and we have bad posture, they will tell us, "Hey mom, hey dad, you that's not good posture." They have changed where they will sit to watch. Like if they're gonna watch television, they don't sit the same spots because they sit with posture. So DJ will grab a certain chair because he knows he can sit there if he needs to get closer. We've even, we are using those sticks, that to help them sit even while watching TV with their mouth closed. And this last time, as we've been working together, we've added that to the car. So there's something in the car for them to sit in the car with something in their mouth if we're going to be in there for a long time. So they definitely, and they're kids, they forget, and I still I still have to remind them every so often. But it's interesting to see them reminding us, because then I know that they know what they're looking for if they're telling us that we're in bad posture.
Yeah, and I just pulled out one of these there's this little plastic thing that I have the kids, they just rip their lips around it and their teeth are lightly touching their tongues up. So during homework or during TV, or I get the kids to close their mouth, because it's really, we need to just restore nose breathing at all ADLs, all the activities of daily life. So
yes,
I'm trying to think, is there anything else that you want to share around? Would you recommend this to other parents?
And it's, it's not, they weren't they weren't on board right away, right? Because it was all new, it was all different. But now they've seen the benefit of it. So when I tell them, oh, we need to do our GOPex, they know right away what it is we're going to do. And they know why we're doing it. And I think that was the most important, is them understanding why we needed to be doing this. And then I'll hear them telling other people, oh, you're not supposed to breathe with your mouth open, or don't, make sure you're not chewing with your mouth open. It's they'll tell, and I'm sure people look at them like, what are you talking? But really that should be our normal. And so I think, getting them involved this young, these were things I had to learn as an adult. So if they know this now and can carry this through, teenager and all of that, it's just going to set them up a lot better. So it's been a really good experience. We ebb and flow with our consistency with it, because I have those two and then another one. But for the most part, the biggest thing is them understanding why. And I think that helps a ton.
Wonderful. So I think that really what I wanted to share with other parents is that there's a lot of kids out there that are, on devices, on phones, on iPads, that are all, slouched over.
Oh.
And when you're in this posture, you end up chest breathing, your tongue goes down, and you end up developing this part of your face. You become more like a bulldog, become more shrunken in and narrowed. And if we continue that into adulthood, we become narrow-nosed, adults that can't really breathe through their nose well. And
right,
nose breathing is where we really have to breathe to maintain good alignment. So I'm so glad that you're sharing this so that other parents can hear this, about how to help posture, breathing, and swallowing, so kids grow straight and strong and they thrive. So thank you so much for your time, Liz. I really appreciate it. Okay, let me continue. All right, so We mentioned taping lips at night. So this is a tape that my mentor, he's Patrick McCowan, who's the breathing Buteyko. He's trained so many people around the world around how to properly nose breathe and restore nasal breathing. This is a tape that we can use, and I will show you real quick what it looks like. So this is actually a child's version. You see it's like stretchy tape. You can put it around the lips. And what does it do? It just shrinks your lips. So at night, you can keep your child's lips closed without taping directly over. I've been taping directly over with my children for years until last year. We actually were able to start using this myotape with our children patients. So this is a great option. We want all our children to grow up tall and healthy with proper craniofacial development and mid-face growth. This happens with proper tongue function, proper posture of the tongue, and nasal breathing. So I just wanted to let you know that we also treat children via telehealth. I mean, ideally, it'd be great to see them once in the practice so that they get to know, the therapist, but we can do this virtually, through telehealth, and it's covered by insurance. Right now, we're insured by Blue Cross Blue Shield, Aetna, and United Healthcare. So there's really, if you can't come to the office, there's no need to come in. We could treat your child through telehealth. And is there any questions? Okay, so let me see. I'm going to wait to see if there's any questions. How young do we treat children? That's a good question. Okay, so children are treated, we see infants to, third generation people in their 90s even. So it's all ages. But the infants, what they get is more of a craniosacral osteopathic manual therapy treatment, which kind of unwinds their fascial system and their craniosacral system. It also prepares them for frenectomies. Frenectomies, remember, is that tongue tie release. So we see a lot of children that have issues with tongue tie that need that training. But at about, I would say my youngest that I've treated that we use myofunctional therapy and GOPex is 3 years old. You can actually start at 3. Do they stay completely focused the whole time? No, but we work with the parents to start doing some kind of nasal rinsing, to start decongesting them, and also using taping and tongue training. So yes, at even age 3, we can see patients. And, all the way, we see teenagers that have terrible posture that need work, so it's not, I need you to know that it's all ages, even infants. Okay. And how long does a therapy take? I would say about 3 to 6 months is the longest period that we work with children. Ideally, with the parent involvement and help, we can do a lot of work with the child. If the parent is not involved at all, then it's kind of difficult because the younger ones need a little help, obviously. But to restore natural, proper nasal breathing patterns, that they use their nose and not their mouth, and use your diaphragm, it takes some time to change that. So I would say maximum 6 months. But we kind of follow them throughout the year as well. We keep checking in with them to make sure things are going well. Okay. Other question is, do you need a referral for physical therapy? Right now we have direct access. If this was a TMJ type problem that we see a lot of TMJ facial pain, we would need a dental referral or a doctor's referral. But for mouth breathing, you do not. So you could call the office. And the office number is right here. We have an office in the Loop and one in Lakeview, and also in Glenview starting in March of next year. Okay. Do you work with dentists that do expansion? Yes, we do. We do. We do work with pediatric dentists that do expansion and orthodontists as well. So we have a team of people that we will refer to depending on what the child presents, and we can refer you to them to make sure that you get a right fit for the team approach for your child's breathing issue. Okay. Any other questions? Well, please feel free to email me if you have any questions. You can reach me at jenniferhobson@physiopartners.com. Our website has a ton of information and videos that you can watch at ptrenaissance.com. Call us at 312-986-9833. And I hope that this webinar has brought some insight to what we do for children. Just know that we are here to help you make your child thrive and succeed and flourish into the amazing adult they will be. So hopefully, if you have any questions, please feel free to reach out to me. Looking forward to seeing you in the future. Bye-bye.